Again with breaking news tonight. Olathe school board members are voting to return students to in-person learning March 1st. It was a 5-2 board vote tonight. This doesn't affect students choosing to learn from home. The board's action also allows any teacher who wants out of their contract over COVID-19 concerns will not be punished. Also tonight, a third COVID-19 vaccine may be on the way. Johnson & Johnson is asking for an emergency authorization from the FDA. This is a single-shot vaccine. Early results show it's 72% effective on moderate to severe cases, and it doesn't require ultra-cold storage. If approved, Johnson & Johnson says it can roll out 100 million doses by the end of June. And we're learning more tonight about Kansas City, Missouri's vaccine task force. The mayor wants this group to make sure that minorities and those without internet access can get the vaccine. KMBC 9's Brian Johnson reports on the group's first full day of work.
With the goal of getting as many people vaccinated as quickly as possible, Item 1 for the COVID-19 Vaccine Task Force assessed the strengths and weaknesses of Kansas City's healthcare system.
Where's their efficiency? Where are their challenges?
Jaron Raven is the president of Swope Health Services. The task force includes professionals from Truman Medical Centers, St. Luke's, Research, and Burns & McDonnell.
The benefit to the city is that we have all the players, healthcare players, talking together.
Kansas City Latinos are dying at nearly 3 times the rate of their white neighbors. Raven says 11 zip codes have been impacted the worst by COVID-19.
Today, Research Medical Center offered to help Swope Health in terms of our vaccination supply. And that's just one example of how we're kind of talking through where we can ask.
They're focused on the most vulnerable populations, black and brown communities, people without internet access, phones, or transportation.
So we're working hard.
While they can't control vaccine supply, they have a big say in its distribution, and community health centers will play a large role.
We're going to work as hard as we can and sharing resources, sharing capacity, sharing staff to make sure that we're getting as many people vaccinated as possible.
Brian Johnson, KMBC 9 News.
Raven hopes they'll soon be able to vaccinate more than 2,500 people a day. The group must report to the full city council in 30 days with recommendations to improve efficiency. 1 week from today, Walmart pharmacies in Missouri will start giving COVID vaccines, but a state analyst says a big part of the Kansas City area, all in blue on the map you just saw, is what's called a vaccine desert. It's why there is talk of possibly a more surgical approach to vaccinations in the city to reach more people considered high risk. Some state lawmakers are frustrated vaccination sites are happening in small towns in Missouri, like this one in Chillicothe, northeast of Kansas City in Livingston County.
At the rate of what we've looked at, and our charts show that they are not nearly as at risk. The risk isn't as high as it is, especially in the inner city communities.
Missouri Health Director Dr. Randall Williams says vaccine events where people are allowed to cut in line and get a shot before it's their time risk losing future doses of the vaccine. Missouri and Kansas continue falling behind when it comes to vaccinations. The national average is 10.2 doses per 100 people. Kansas is at 8.3 doses per 100 people. Missouri's at 7.9. Kansas and Missouri rank 52nd and 54th among all states and territories. 88 new cases of COVID-19 and 4 new deaths are being reported in Kansas City, Missouri tonight. That's more than 36,000 cases and 452 deaths since the pandemic began. The average number of new hospitalizations, though, continues to fall. And there's a nationwide survey out tonight indicating a lot of people are worried Super Bowl parties this weekend might turn into COVID super spreading events. Because of pandemic restrictions, we won't see a scene like this from last year in the Power and Light District. The survey of 1,000 adults commissioned by the Boston-based think tank, the Workforce Institute at UKG, found 69% of those surveyed are worried about Super Bowl parties this weekend. 11% surveyed plan to go to a Super Bowl party where there will be no COVID-19 precautions.
I think that goes across the gamut of what people believe when it comes to the pandemic, but it is to me that's still surprisingly high given, what's going on in the news, what's going on in the US with these new variants.
In that same survey, 57% of those polled worried about going to work next week because colleagues may have been exposed to COVID at a Super Bowl party.